declined, this time by 13%. But despite this reduction, the region still accounts for 40% of new global cases and 50% of new global deaths, as almost half of the countries within the region continue to show an increasing trend. In week 48 alone, over 35,000 new deaths were reported from across the region. Whilst we are seeing a slight decrease in the number of cases in Western Europe, this does not mean the entire WHO European region faces an improvement in the epidemiological situation. The resurgence is moving eastward, with the hardest hit countries now in Central and Southern Europe. These reports are of grave concern, a stark reminder of the fact that the vast majority of us remain susceptible to the virus. Seroprevalence surveys suggest that in most countries, less than 1 in 10 has been infected with the virus. This is a time for responsible leadership. To those countries seeing a decline in transmission, use this time wisely. Consider scaling up the public health infrastructure and preparing for the next surge. Ask what can be improved to help us manage better in the future. The virus still has the potential to do enormous damage unless we do everything in our power to stop its spread. And part of the solution will be vaccination. Today I would like to share 3 messages on the forthcoming vaccines. First, and undoubtedly, the promise of vaccines is phenomenal. The reward is potentially game-changing. With more than 200 candidate COVID-19 vaccines under development, the future looks brighter. That is why I welcome news of the interim results of several candidate vaccines in recent weeks. As of today, more than 50 candidate vaccines are in human trials. The more candidates we have, the more opportunities for success. Vaccines combined with other public health measures bring the end of an acute phase of the pandemic and the rebuilding of economies within reach. But this is only possible if we ensure that no one is left behind and all countries and communities can reap the benefits of access this life-saving technology. My second message, preparedness is key. To assure that we reap the full reward of those vaccines, we need to have plans in place. Taking immediate stock of the status of our preparedness, now in advance of the arrival of vaccines, is absolutely essential. At WHO, we are working with countries to strengthen their readiness for vaccine introduction, their cold chain capacity, vaccine safety monitoring, communication and community engagement. With supply expected to be very limited in the initial stage of delivery, all countries must decide who should be vaccinated first to maximize the impact of limited doses in reducing the burden of disease in each country context. Our recommendations are that health and social workers, adults over 60 years of age, and residents and staff of long-term care facilities should be prioritized for access to COVID-19 vaccines in the context of a limited supply. We acknowledge that depending on vaccine availability, disease epidemiology, and the size and proportion of each priority group, countries may decide during the initial stage of immunization to prioritize more than one group at a time. And thirdly, community acceptance and demand is pivotal to the success of any vaccination plan. Behavioral insight surveys conducted among several European countries in recent months indicate that up to half of people in some countries are unsure about vaccination against COVID-19. It is not unusual to be concerned about vaccination. It is understandable. This can be expected in the current circumstances, in which much is still unknown about which vaccine or vaccines will eventually be licensed, when they will be available, and potential side effects, if any. I urge you to seek reliable information from trustworthy sources. Don't be part of a misinformation infodemic. Vaccination saves lives. Fear endangers them. All information and data from the clinical trials will be thoroughly assessed for quality, safety, and efficacy by national regulatory authorities before a vaccine is licensed for use. Such established mechanisms have been in place for decades to ensure the quality and safety of vaccines used to protect children in Europe against diseases including polio, measles, and diphtheria. So the promise of a vaccine is great, but its full potential will not be realized without strong preparedness and community acceptance. But let us also be clear, the vaccine is not here today. Not everyone will receive it when it arrives. Therefore, it is imperative that we continue to practice basic protective behaviors, such as mask wearing. We have seen progress made in Europe over the last number of weeks with the application of measures which, however difficult, have reduced case transmission. We must remain vigilant to maintain this progress, to protect ourselves, our loved ones, and our health workforce. Thank you.
Thank you very much, Dr. Kluge. We will publish the text of Dr. Kluge's statement on WHO European website in about an hour. If you need it urgently, please send an email to the contacts, including in the media invitation, and our team will send it to you urgently. Now we can open the floor for questions, and we'll do it via Zoom only. So you'll just have to press your raise hand button. I'm getting some raised hands online and some questions submitted in advance, and I'll try to combine and alternate both lists so that everybody has a chance to raise a question. And let me start with the written questions. The first one comes from Linda Kennedy. She's representing International Broadcast Agency Future Story News. And the question is the following. I'm reading the original version. What is your reaction to the United Kingdom approving through its own regulatory MHRA rather than the European Medicines Agency, the Pfizer BioNTech vaccine, and what would you say to people who are nervous about the speed of the approval? It's mainly a technical question, so I'm looking at Dr. Datta. Dr. Datta, can you help with the answer?
Thank you so much, Luba. Thank you, Linda, for that question. So let me then break this answer into two different parts. The first part would be, as you have heard Adi say earlier, the national regulatory authorities of a country will review the different elements of a system before they make the vaccine license for use. Their safety, efficacy, and quality of the vaccine. That is what the UK's National Regulatory Authority has done yesterday with their evaluation. We have learnt about it and we acknowledge it. We are also aware that the Pfizer vaccine, the vaccine developers have also submitted the papers, the documents for assessment to the European medicine agencies. These are done over a period of time through a rolling review. That means you don't have to wait until the final results are being made available. This process of rolling review provides an opportunity to quickly review this information before the final decision has been made. But finally, if I can put the other part of it, this confidence on the national regulatory authorities is quite important, given that the population who will be the final taker of this vaccine will need to be instilled trust on the decision being made. And that robust process of looking into the data for the safety, efficacy and quality is extremely critical moving forward for the vaccination program.
Thank you very much, Dr. Data. I'll take another question from the list submitted in advance. Oskar Gorzinski from the Polish Press Agency, who is following us regularly, is asking, several European countries have already announced their vaccination strategy. The approaches to which groups will have priority in accessing it in the early stage vary slightly. Are there any WHO guidelines or pointers with regards to what the strategy should be? And I'll ask Dr. Hans Kluge to kindly answer that question.
Right, very actual question. So WHO has since a while developed a so-called allocation framework to prioritize certain groups, which coincides with about 20% of the population of a country, the top priority being the health and social care workers, about 3% of the population. Then people older than 60 years, and then people with what we call comorbidities. It means several diseases, usually chronic diseases, non-chronic diseases at the same time, which lowers the immunity. The COVAX facility is very committed that when the first vaccines will be available, that there will be no difference between the countries which have subscribed to the COVAX facility, that those priorities which will be adhered to. Obviously, I was mentioning in the statement, it depends also on what the country decides, but we do see, I believe, a growing consensus across and among the countries that those are the priority groups.
Thank you. And I'm looking now at the list of journalists online. We have Gunilla von Hall from Svenska Dagbladet. Gunilla, can you unmute yourself and ask your questions, please?
Yes, can you hear me?
Very well, go ahead.
Thanks for taking my question. My question is, how efficient do you think the vaccination against the COVID-19 can actually be when there seems to be large parts of many populations that will not actually vaccinate themselves? They want to wait half a year or a year. And a question linked to that is, how worried are you that people, once there is a vaccine on the market, that they will be less careful in keeping distance and washing their hands and having the hygiene, which could also be a risk for the virus to spread? Thanks.
Thank you very much, Gunilla. I'm looking at Dr. Data, and he's ready to take your question. Dr. Data, please.
Yeah, thank you so much, Gunilla, for that question. You have touched two different aspects, and let me also break it down into two different parts. The first question, you said population is willing to wait for the vaccine to come through. As you heard RD speak, the demand for vaccine is not commensurate to the vaccine volumes that are available at this point of time. That brings back to the question of prioritizing population groups so that they can receive the vaccine when the vaccine become available. The last, the answer which RD has mentioned, countries have been given guidance from WHO to prioritize the population groups within the overall population. But however, the apprehension or the perceptions of the population towards this new vaccine is fairly understandable. The behavioral insight studies done by WHO Europe is also showing the people's perception or concern about this new vaccine. They would wish to wait for the new vaccine. This brings back to the question of what the national authorities in a country, the ministries of health, and other agencies should be doing. That is transparency in sharing the communications to the people who should be the ultimately utilizers of this vaccine. They would become less careful, as you say. But I think the point which RD mentioned is very critical. Vaccine alone in itself, at least in the short term, will not bring an end to this epidemic. What will bring an end to this epidemic would be vaccine, along with other proven public health measures which WHO has already outlined and countries have shown it makes value. Thank you.
Thank you, Dr. Data. Now I'm going to the next questions that are submitted in advance. It's from Camille Bar-Wallert. Camille, I can from the Agence France Presse. Camille, I cannot see you online, but I hope you'll have the possibility to listen to the answer later in the recording. So Camille was asking, now that vaccines are in sight and vaccination plans rolling out, I'm wondering how WHO Europe is going to follow the number of vaccinations in the region. Maybe a dashboard like the one on the COVID-19 situation would be good. Dr. Datta, please.
Thank you so much, Kemi, for that question. I really appreciate that insight when you talked about measuring. And I think WHO, as an evidence-based organization, always had been telling we need to measure and to know what activities are being done in a country. That brings back to the question that applies for not only when the vaccine is available, just before that. You heard Adi say earlier, preparedness is key, and WHO is working with the different member states to understand their preparedness level. We have developed a regional monitoring mechanism where countries are submitting their preparedness status. It's good to really see that happening and member states valuing this reporting and monitoring mechanism. Within the wider monitoring and evaluation framework of the COVID-19 vaccine deployment and vaccination, measuring the uptake of vaccine will be extremely important and critical, both for planning purposes in the country and doing some mid-term or mid-campaign changes as the program would need to be doing during this period of time. WHO has already made plans to develop a dashboard for everybody, the member state themselves, to see where they are and compare and then make changes, but also for the public to see the changes being made, as you have highlighted for the COVID-19 response that WHO has got. We'll keep you posted on this as we move forward. Thank you.
Thank you, Dr. Datta. We have Euronews, Lauren Chadwick online. Lauren, can you hear us?
Yes, I can. Thank you so much for taking my question. WHO earlier this year had dismissed immunity passports for people who have already had COVID-19. But as we're seeing vaccines emerging, could you talk a bit about what your view is on a future vaccination passport for populations or for travelers? And then my second question, if I may, the ECDC noted in a report yesterday that the prevalence of SARS-CoV-2 in travelers is estimated to be lower than in the general population. Do you support testing at airports and for international travel, especially when transmission is not at the same intensity between countries? Thank you so much.
Thank you very much, Lauren. Dr. Smallwood, have you heard the question well? Because I would like to pass it on to you. Do you want to repeat? Is it okay?
Yes, I heard the question. Thank you, Luba. And I would also invite my colleague Siddhartha to say something about vaccines. At the moment, WHO's recommendation has not changed. We do not recommend immunity passports, nor do we recommend testing as a means to prevent transmission across borders. What we do recommend is that countries look at the data on transmission, both within their countries and beyond their borders, and adjust their travel guidance to people accordingly. The other key component is, of course, to prevent people who are isolated because they are COVID patients, or to prevent people who are in quarantine because they've been exposed to a case from traveling at all. And that is the crucial importance here. Indeed, when it comes to the prevalence among international travelers, those tend to be lower than the prevalence in some countries, depending obviously on the country itself. So this is really important to take into account when defining testing within populations in general. And that's why certain tests are less appropriate for international travel, such as rapid diagnostic tests that detect antigens.
Thank you very much, Dr. Smallwood. Dr. Datta, any additional information?
Yeah, thank you so much. And building upon what Katie mentioned, for the vaccination passport for the travelers, Just to let Lauren know that we are looking very closely into the use of technology in this COVID-19 response. And one of them is how can we work with member states towards something called e-vaccination certificate, an electronic vaccination certificate. But before we jump into that, I think it will be extremely critical that we keep few things on our mind. One, use of technology vis-a-vis the different legislative framework that exists in a country. The second one is the programmatic feasibility of implementing it across the globe or even across the WHO European region. These things are also to be coupled while planning for it, the capacity of the health system at this point of time to respond to any new innovations while they are already engaged in COVID-19 response. We are working very closely with the European Commission and the European CDC to understand and learn about some new technologies and innovations being already done in several countries of the European region. As you would know, WHO has signed a contract or a memorandum of understanding with Estonia to look through these digital innovations in COVID-19 response. One of them is this entire vaccination certificate. As we work together to the member states on this, we'll be very happy to keep you posted on thereafter. Luba, over to you.
Thank you very much, both of you. Dr. Kluge, I have a question for you from Ioannis Gorantis from Inside Story in Greece. And Ioannis is asking the following. Dear Dr. Kluge, thank you for taking my question. Yesterday, you sent a message to the Greek people asking them to do everything in their power to stop the spread. Ioannis is talking about a press statement Dr. Kluge distributed yesterday to the Greek media. But the vast majority of Greek population, as most of the people all over Europe, are doing their best by abiding to strict rules for months. What about the governments? Do you believe that they are doing their part, especially in terms of mass testing, adequate contact tracing, and isolation? And finally, do you agree that by constantly blaming the public, we may have the opposite results?
Evcharistoupoli. So, a number of points here. We all have to do our share. As I was mentioning, with the arrival of the vaccine, this is not the end of the pandemic. So everyone in the population, please to adhere to the public health and social measures, the basics. The hand washing, the cough hygiene, the physical distancing, stay home if sick policy, and the generalized mask wearings and avoiding large social gatherings. We do not blame the people, even the people that or upon occasionally not following, or let's say fatigue, they're tired, because we see this in many European countries, the pandemic fatigue. We have to understand which part of the population in particularly has problems to adhere to the measures and also is unsure about the COVID-19 vaccine, and to engage them. And we do have quite some experience from similar situations, for example, the last years with measles, particularly in the European Union. So we need everyone on board, just like we need, I was mentioning, responsible leadership by the government. Now, I see that the governments in Europe are really mobilizing their technical, operational, political instruments to do whatever they can. And on the daily basis, I am talking to ministers, prime ministers, presidents, recently with Minister of Health, Vasilis Kikilias, who also came during the pandemic crisis to Copenhagen to further strengthen our collaboration, and now developing also together a national vaccination plan. Finally, I want to thank and express my great admiration to the Greek people. The Greek people have done a lot, but this is the time. We're almost there, but still we need the next months to stand together to protect ourselves, but also the families around us.
Very much, Dr. Kluge. we have Esmir Milovic from N1 TV Bosnia with his questions online. Esmir, can you unmute yourself, please?
Yes, thank you, Luba. My question is probably for Dr. Kluge, but also for Dr. Nata. The one is, do we know when the regulators in Europe will give a green light for vaccines here in the continent, depending on their regulatory bodies and everything else? And the second question, Dr. Kluge, can you go a bit further on your comment regarding Southern Europe? Because just we learned that Croatia has 4,500 new cases today. Bosnia has 1,100 cases. So how do you see the situation in Southern Europe? Thanks.
Thank you very much, Esmir. Because we have both technical and general parts of the question, so I'll basically ask everybody to contribute. Who wants to start?
Right. I will start, Esmir. Indeed, yes, am I concerned? I'm definitely concerned, but not only about Southern Europe, but also across the region. Why? Because the virus has not gone away. So that's why one of the points, when first of all countries need gradually to implement restrictive measures. We are not advocating for a lockdown, which is a shutdown, but gradually, depending on the severity of transmission in the community, to be stricter. At the same time, what we learned since March is when governments are putting some kind of lockdown to do a mitigation of the risks for collateral damage. Mental health, domestic, gender-based violence, people losing their job, they need microeconomic support, children with disabilities, and so on. And we do have frameworks. But in a nutshell, Izmir, we know what works. We know what needs to be done. In countries where the governments were decisive and promptly implementing measures, the transmission has been pushed back. But where governments were in, let's say, hesitating, or there was partisanship, it has not worked. And one of the key issues we know, which is low technology and which is cheap, is a generalized mask wearing and a strict control on social gatherings, including on religious gatherings like mass funerals. Thank you.
Dr. Smallwood, can you also add something on the numbers that Esmir was interested in Croatia?
Yes, thank you very much, Izmir. As the regional director highlighted, the whole epidemiologic situation in Europe remains fragile. We cannot say we're in a stable situation across the whole region at the moment. But what we have seen over the past few weeks is that mainly in Western Europe, where we saw a very significant increase in transmission earlier, that the restrictive measures that were brought in, some of them really quite robust, have brought down the numbers of cases, have brought down the numbers of hospitalizations, and have brought down the positivity of positive tests recorded on a weekly basis. Those numbers still seem to be very high in other parts of the region, and as you rightly state, the 14-day increase in cumulative incidence, so that's the difference between the last 2 weeks and the 2 weeks prior to that, has increased very significantly in countries like Serbia, in countries like Croatia, but also is increasing in other countries around the Balkans, around Central Europe, and also in the South Caucasus. So this is a cause of concern. We're looking very closely at the hospitalization rates as well that are continuing to increase, and the numbers of deaths that are being recorded for COVID-19. So this means very much, as the regional director says, we need to be comprehensively much better at collectively implementing the public health measures and social measures that are already in place. As we've noticed, there's a lot of fatigue, there's a lot of lax implementation, and we need to remind ourselves that this hasn't gone away, it won't go away, and over the Christmas and winter holiday periods, there's a very real potential of it becoming even more of a problem as people try to gather in their families, as communities, and in religious congregations. So now more than ever is the time to implement what we need to do individually, but also at a collective level. Thank you.
Thank you, Dr. Smallwood. Dr. Datta, do you want to conclude on that?
Yeah, thank you so much, and thanks, Asmi, for that question. So I will be providing you some information on the regulators part that you have outlined. So you have asked us a particular date, and just to let you know that the context is that the regulatory authorities will need to really take some time to review very closely of all the three different elements that I have mentioned in my earlier reply: the safety of the vaccine, the efficacy of the vaccine, and the quality of vaccine. European Medicine Agencies, who is the authorized regulatory agency to take care of the decisions on behalf of all the EU and the EEA member states, as we have learned or have heard from European Medicine Agency yesterday, they sometime during this month, they will be reviewing and these information and making a decision. However, in the same context, the evaluation of the Pfizer vaccine, which was done by the UK's National Regulatory Authority, both WHO and European Medicine Agency have reached out to the UK for sharing of this information. This is extremely important that we do see the value of having a rolling review of the results of this vaccine and other vaccines as well, which is coming up, so that we can reduce the time taken for vaccines for license to use. The last part would be, I think it is important that we send the message out that this decision is a big decision by any of the national regulatory authorities, because it will instill trust in the system and all the population who will be receiving this vaccine. So it's extremely important that this process is robust, process is based on evidence, and a decision is being made and shared in a transparent mode. Thank you.
Thank you so much for a comprehensive answer. And now we, just a small note for Roland Manthorpe and Stefano Valentino. Can you please add your media title outlets, because I cannot see if you are media representatives. If you cannot do it on Zoom identifier, please send them by chat. I'll check the chat. So now I'm taking Tony Waterman from CGTN. Tony. Tony, can you hear us?
Okay, I can now. Thank you very much. I just wanted to touch base again about the UK approval, because some have suggested that it was hasty in approving the Pfizer-BioNTech vaccine, including the former head of the EMA. And I wonder if you think that the approval was hasty, and even if you don't, if there is an appearance for the public of swiftness in this approval, if that is going to end up undermining one of the pillars of vaccination, which, as you've mentioned, is instilling this trust and confidence in the vaccine itself. Thank you.
Tony, thank you very much. Dr. Datta, I think you already mentioned something, but if you can answer Tony's question.
Yeah, thank you so much, Tony, for asking that question. The use of vaccine in the UK for all childhood vaccine and non-childhood vaccine is ongoing for several decades now. The regulatory authority in the UK has been making the decision on use of the vaccine in a country based on the vaccine characteristics for safety, efficacy, and quality for several decades now. The process of using a vaccine or authorizing a vaccine for use in a country is done very routinely by the regulatory authorities in every country in the globe, including the UK. As we have taken a note of the decision being made by the UK's National Regulatory Authority, WHO is also in touch with European medicine agencies and also the UK's authority to understand the decision-making process. The process was shared. The decision-making process was shared also with the general public and also with the healthcare professionals on the different modalities that were being assessed and the final decision being made by the regulatory authority of UK yesterday.
Okay, thank you very much. Now we have Stefano Valentino from Vox Europe, who wants to ask a question. Please, Stefano.
Yeah. So yeah, I would like to follow up on the safety and trust issues. So as you know, the contracts signed by the European Commission and the pharmaceutical companies, they provide for governments basically to cover the damages produced potentially by side effect of the vaccines. And these pharmaceutical companies wanted to have this provision in the contract, saying precisely that the vaccine were developed very fast, and then they don't want to be responsible of the effect of the fact that the vaccine was developed so fast. So, don't you think that this provision, as such, doesn't really build great confidence in people? And secondly, I heard by many experts that around the world there is not enough manufacturing capacity to produce vaccines for everyone. That if you want to produce vaccine for everyone, basically we should stop producing any other kind of drug and vaccine. And on the other side, there is no agreement between COVAX and pharmaceutical companies about the waiving of exclusivity on licensing. And so combining the limited manufacturing capacity and the fact that there is no sub-licensing agreement, don't you think that this will make pressure and the price will not be so low enough to make the vaccine affordable for everyone?
Thank you very much, Stefano. I think it's because it's in continuation with the previous question. Maybe Dr. Datta can help. Please, Dr. Datta.
Thank you so much, Stefano. You had several components in your question. I will try to see if I can cover. The first thing, let me tell you, you talked about at the end about affordability. WHO, as a part of its global solidarity, has been telling from the day one that irrespective of a country's income level, irrespective of where a population stays in a country, the vaccine, COVID-19 vaccine, which is a global public good, should be available for everyone. And I think that stands and remains our pillar. You talked about manufacturing capacities. Indeed, the demand for this vaccine, as you also have heard RD say, is not commensurate to the vaccine production volume. Within the COVAX facility, one of the mechanisms is to work with the manufacturers and different vaccine developers to see that the capacity production volumes are being enhanced. Within the COVAX facility, it entails to achieve 2 billion doses by the end of 2021, which will be linked to the 20% of the global population volume, which RD mentioned earlier. You talked about development being faster. This is an unprecedented effort being made by the global vaccine developers and the manufacturers to develop a vaccine so that this could be added as one of the tools to bring an end to the acute phase of the pandemic. But that does not necessarily mean cutting corners. All the phases of development of a vaccine, including assessment of the safety and efficacy, is being followed. The regulatory authorities in any country and any agencies are playing that big role. So you talked about liability, covering of the damages by a country. We are working very closely with several of the member states to understand two different perspectives of this process. One, we all have to understand that this is a novel vaccine using several different platforms which has not been used regularly in the immunization program. There is a discussion with the ministries of health and also within the ministry, the legal departments, to understand how this process can be fastened and given a trust which is needed for the population for each and every aspect of that vaccine. Going into the liability per se, the vaccine use by the licensure by the National Regulatory Authority, linking it to the vaccine safety monitoring in a country when the vaccine is being licensed for use will play a big role. Each and every country in the region, WHO European region, have got something called putting a process in place for causality assessment, assessing the causality of any safety events that may happen. So just wanted to put in the finally would be this liability covering of damage will allow WHO and member states to work together within the COVAX facility and address it.
Thank you, Dr. Datta. We have Bloomberg Online, Corinne Gretler. Corinne, can you hear us?
Thank you so much. I have a question on your vaccination dashboard, just to get an idea of what exactly will be available. Will the data collected include subcategories like age, like professions like healthcare workers or nursing home residents, which vaccine it was? Will there be vaccination rates net and per capita, and links to government sources? Just kind of an idea, because I know everyone else is preparing, but so are we in the news business.
Corinne, thank you very much. A very important question. Dr. Datta, if you can help.
Thank you, Corinne, for that question. At this point of time, what we can say is within the wider monitoring and evaluation framework for the COVID-19 vaccine deployment and vaccination, obviously there will be a desire by the global community to understand quickly a few things. Number one, which are the population groups that a country is prioritizing when the vaccine doses are limited? And then what is the vaccination uptake in that population, in those population groups when the country starts implementing the vaccine? Moving into your subcategorization of the population groups is, I'm sure each and every country will look into it much more detail, because that is where the action will happen. If any changes have to be done in the vaccination strategy, that is where those information will come handy. I also understand and appreciate the global appetite to learn further on this. We have to also be cautious that the health system should be able to detect and to enumerate these different subcategories and then provide the information. We are working with our member states on two different fronts with the vaccine dashboard and the vaccine data. One is, what are the information that would be needed for policy and planning purposes? The other one is, what is needed to make implementation effective? The resident care facilities and the health workers at risk and people more than 60 years, as you have heard RD say, these are the priority groups, and we will be monitoring that information very closely. And as the system matures, I think the other different elements will be added onto it. Thank you.
Thanks a lot. Dear panelists, we have 15 minutes to go and 3 more questions. I can see Roland is online and he added his media title. Thank you very much, Roland, but I cannot see your hand. If you're still interested, please raise your hand. Now we have Karen Wolfson from World Health Alert Crisis. Karen, if possible, a very short question. Karen, can you hear us?
Unmute. Can you hear me?
Very well, go on. If possible, very short.
You can hear me now?
Very well. Go ahead, Karen.
Okay. My name is Karen Wolfson from World Health Alert Crisis. Good morning. The vaccine development is very positive. However, given the acceleration of COVID-19 with over 12,000 deaths reported in the last 24 hours and reaching a tragic 1.5 million deaths worldwide today, first of all, do you think the WHO should be course correcting? Given the data, it shows that schools are the overwhelming drivers of the second wave, with infections in 10 to 18-year-olds in particular. And a teenager died in England yesterday who had no underlying conditions. I mean, there's more than one, but that was yesterday. Transmission in schools, should they go on to remote learning? That's what the WHO originally said. And the virus is currently running wild in UK schools. Do you think the UK should course correct in order to underline where there is community transmission that 10 to 18-year-olds should go onto remote? It's causing a great deal of stress for many, many children all across the UK, many parents who are threatened with fines if they don't send their children into school because they're worried about COVID. And many children
Karen, I'm very sorry I have to stop you because we have only 10 minutes to go. So we understood the question and we'll answer it right away. Thank you so much. And I'll let Dr. Kluge start and then Dr. Smallwood, if you have anything to add, please.
Very actual point, Karen. And good morning. Thank you for joining us. So the advice has been to try to keep schools open as long as possible. But there is more and more evidence indeed, and we have been putting this out consistently, that the primary schools in particularly are not drivers but followers of the transmission. But as you are telling yourself, with secondary schools, with universities, the picture is different. The key issue here is that schools are not a biotope standing on itself. And I think you also mentioned this. It depends a lot on the transmission in the surrounding community. And then in a number of outbreaks, what was documented is that the transmission of the virus is ongoing when the children are leaving the school gates, that it's linked with socializing once the kids get out of the school, also the transport issues, but there is still a lot of research ongoing. So we're playing this very shortly on the ball with the new evidence, and in fact, next week there will be the second region-wide high-level meeting which I will co-chair with the Minister of Health of Italy, Roberto Speranza, with the 53 Ministers of Health and also Education to look into this matter, and particularly then with which measures to be put in place, going from alternating smaller groups, the basic public health measures of physical distancing. But what we say that if schools are to be closed, that the big lesson learned this time is to pay special attention to the children with disabilities, with special needs, which were left alone in the first wave.
Thank you, Dr. Kluge. I'm looking at this screen. Dr. Smallwood, if you have anything to add, if not, we move on. You do. Go ahead.
Yes, I just want to underline something that the regional director alluded to, but is key here. To bring transmission down in schools, we need to bring transmission down in communities. And this needs to be the main emphasis of our efforts. Keeping the schools open is possible if we bring transmission levels down to appropriate levels. And this needs to continue. There's been positive signs in the UK. We must recognise that. There's been positive signs in other countries. This needs to be sustained. Governments need to take very clear, responsible decisions, including over the holiday periods that are coming up, to not waste that effort. Thank you.
Thank you very much. And we now can go for a second round of questions, and I'm very glad to do so because actually I just got an email from Camille from Agence France Presse with a quite recurrent question. I'll read it. This is a time for, Dr. Kluge, you said that this is a time for responsible leadership. To those countries seeing a decline in transmission, use this time wisely, you said. Consider scaling up the public health infrastructure and preparing for the next surge. Ask what can be improved to help us manage better in the future. Now, Camille's question. Does it mean countries need to prepare for a third wave? And she also has a next one about the vaccination. How many people could be vaccinated in Europe around the first quarter and the whole of 21? So the first question, I guess, is for Dr. Kluge, and the second, Dr. Data, if you could help and advise. Thank you.
Thank you, Camille. Frankly speaking, whether it is a first wave, a second wave, or a third wave is a little bit less relevant. We see this as one pandemic, one big swell. But the question itself is very relevant because we're looking, many of us, towards the holiday season, towards Christmas, whether it's call it a third wave or a Christmas wave. So the question we have to ask ourselves is, if we're going to come together, or we're thinking about an activity during which transmission can happen, we have to ask the question, is it really necessary, for example, to go skiing, number one? Number two, can it be postponed? And number three, can it be done differently? Because if the restrictive measures are being eased and the basic public health measures are not adhered to, whatever the country in the region or globally, absolutely there will be again an increase because the vaccine will come too late for this winter.
Thank you so much, Kemi, for that question about asking what proportion of the population in the European Union or European region would be covered. So just to highlight, the decision lies with our member states to prioritize the population groups, which will indicate what proportion of the total population will be covered in a country with the available vaccine. That decision is extremely critical. Any decision made in a country on the proportion of population or a population group is dependent on the vaccine availability. As vaccines become available in tranches, as you have heard the RD speak earlier, this will become much more clearer for us to assess what proportion of population will be covered in the initial tranche and then in subsequent terms. We would not be able to give you a specific number at this point of time, but as we engage further with our member state to understand their priority groups, we'll be able to estimate. Given that 20% of the population is expected to be covered through to the end of 2021 globally, that also includes the WHO European region, through the COVAX facility, that is a number we are all working for on planning purposes, while we understand for implementation will differ by country, and that will be a task for both WHO and other partners, including the member state, to come together to make that assessment. Thank you.
Thank you both. I think we've now closed. We don't have any more questions online or in advance, so I think we can close our press briefing now. Thank you, everybody, for participating. But before we close, a small note for the journalists. We will post the video of this briefing on our YouTube channel. It may take a couple of hours or so, but if you need it urgently, please send us an email to the addresses provided in the invitation, and we'll transfer the file to you in a different way. So have a good day and stay healthy. Bye-bye.